from part one. You can join the Facebook page right now. It's actually on our Facebook page. Today is an important session because it's for cluster. And your exam, it's all about cluster itself. How to live, to sleep. Okay, give me 1 second, please. Into something here. Let me just get this one here. Good now. By the way, guys, I know you may have part one and part two champions here, some of part one and then most of part two, all the way around. So, guys, if you are part two, I have posted for you, even for part one as well. You can check this. I posted for you how to fix a neck tooth because sometimes your neck could damage adjacent tooth while you're doing crown prep. In this case, I just to give a small hint how to fix it. And you'll find this in the OSCE group, by the way. Okay. Let me start right now. Let me just shift in here. Okay, guys, I'm just double check right now if I'm online or not on the Facebook. Seems like I'm online. Seems like. Let me double check again. Okay. We're just, guys, waiting for the rest of the champions and then we'll start straight away. As always. Okay, guys, I believe it's a good time start right now. Please, admin, admit the champions because I see here that we still have champions on the waiting room in Zoom. So please ensure you admit everyone. Okay, guys, let me go back again to my slides and then the Facebook. Let me check the Facebook, what's happening there. Get this one in. Okay. Guys, would you like to have mock soon? What do you think? Because I'm planning to do mock. Okay, just... Okay, great. I can see that I'm on Zoom right now. I'm live in Zoom. Hi, Dr. Simran. How you going? Let me just get this one the right way. Back again for my slides. Okay. Yep. Hi, Dr. Natalie. How you going? Hi, Dr. Jaylan. How you going? Dr. Rana. How you going? Dr. Alifea. How you going? Dr. Taslim. Dr. Maria. Dr. Sangeeta. Dr. Bala. That's a nice name, Dr. Bala. Blah, 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 right? Dr. Fatima, Dr. Taslim, Dr. Simran. Dr. Shashank, Dr. Magda, and Dr. Fatima, and also Dr. Shiva. Thank you, guys. Dr. Nikita too. Okay. So the today class is actually a very important class because this is how things works things work in Australia. Either for part one or part two, ADC actually has made the exam based on what we call it as clusters. Hi, Dr. Ashik, how are you going? Dr. Nikita and Dr. Trisha. What does it mean exactly? What's the importance of cluster? And why class is important for your exam? As you see right now, the importance of clusters. Just to make it easy and simple for you, you cannot pass the exam unless you pass every single cluster. In part one, as you see right now, you have 4 clusters. And part two, they actually have 3 clusters mainly in OSCE. They have more than 3 clusters in different parts, but mainly in OSCE they have 3 clusters. Why class is important? Again, as I said, because you need to pass every single cluster. You cannot pass 2 clusters only and then you expect to pass the exam. Before we start about the cluster, this question was in my head yesterday. I don't know why. Guys, what do you think the answer to this question, by the way? It was in my head yesterday. And I said, okay, what if we just give them this question today to think about it? What is the answer to this question? Let me guys check your answer here on Facebook. Hi, Dr. Muhammad, how are you going? Dr. Shashank, how are you going? Guys, what's the guys' answer here? Hi, Dr. Lakshmi, how are you going? The delta silver ions, not oxygen releasing compounds, not iodine, not sodium hypochlorite. Silver ions? Oh, guys, everyone happy, guys, with silver ions? I'm very happy then. If you are happy with silver ions, I'm happy with silver ions. Yes, I'm happy to. Okay, as long as you answer it right, which I believe all of them can be used. Iodine, iodine compounds can be used. A oxygen releasing compound can be used. But I believe silver ions, that's the one which is used for most of the time. Okay? Yes. If you go into check infection control guidelines, you may find all the options are correct. However, thank you, Dr. Mohammed. However, silver ions is the best. Okay, back again to cluster. Now, the difference of each cluster. Think about it. Let's say you are part one candidates. How this can help you? Because you see some of you actually go into the exam. And then they look at the scenario. And then they look at the questions in the scenario because every scenario is 5 questions. And then they keep thinking, is this question is information gathering cluster? Or is it diagnosis management or professionalism and responsibility and ethics? Or is it clinical treatment and evaluation? How to know it? We're going to discuss it in details now. But what's the benefit to know it? It has a good benefit, especially when you choose the right answer. Also for part two, it's important for the same reason. Because if you cannot identify which cluster you're talking about, you will not be able to provide the right answer. And also, you will not be able, if you are in part 2, to answer the patient reasonably, and then the patient will not get convinced. That's why it's really important to know the difference between each cluster. So in this case, you can tell what exactly you need to choose, because definitely the questions and information gathering, the answer will be different then. The question for diagnosis and management will be definitely different than clinical treatment and evaluation. Looking at this case, what do you think this cluster is? Let me check your answer. Dr. Mosa, it can be option C, all of them correct, but silver ions is actually, I would say, the most common one and the most effective. Look, guys, at this scenario. If I'm gonna give you some questions on this scenario, do you think is it information gathering cluster, or is it diagnosis and management, or is it clinical treatment and evaluation? I see Dr. Sangeeta mentioned the questions here will be related to information gathering. Dr. Nikita say it's information gathering. Dr. Fatima check cluster 1. I mean, if I'm going to give you question here, if I'm going to ask you questions related to the scenario, what sort of questions will be? Dr. Shashank mentioned diagnosis and management. Dr. Lakshmi information gathering. Dr. Amri information gathering. Dr. Natali information gathering. Dr. Taslim diagnosis and management. Dr. Shiva diagnosis and management. You see, guys, when I see differences in the answer, I know things not clear. Right, Dr. Musa say, okay, no problem, Dr. Musa at all. Okay, now there are two groups right now. One group is information gathering cluster, and then the second group is diagnosis and management, and no one has mentioned about clinical treatment and evaluation. Now, saying this, you know what? I will keep the answer later on, not now. Right? I will tell the answer later on. I said if I have this scenario, what do you think the scenario about? Like what can be your job in this scenario, right? Okay, Dr. Musa mentioned information gathering. Dr. Simra information gathering. Dr. Mariam information gathering. Dr. G. Lampis diagnostic method. Back again to the slide. To know the answer of this question, you should know the difference between each cluster. Information gathering cluster, the scenario will not mention that much details. Mostly, you will find the scenario about, the scenario may have chief complaint, and then maybe some signs, some symptoms, and then mostly no investigations, or let's make it more accurate, no special investigations. When I look at this such a scenario, you may expect this is information gathering cluster scenario. Why? Because your job in this case is to gather information. What sort of information normally will be? Normally will be special investigations. What are the special investigations? Guys, can you give me guys an example of special investigations? We have agreed last time That wordings, very important. The language you use, very important, because in Australia we only use one language. Maybe there is a funny dentist again say yes we use English. No, I don't mean English language. I mean like dental language. We have only one dental language we all use in Australia. So when I say special investigation, I mean something out of this world. Let me check your answer. Transformation, very good. Biopsy, I love it. Vitality test, perfect. Vitality test can be special. It's investigation, but special, maybe, but not as percussion. No, sensibility test. I don't really see it as a special. Percussion special. Mm, look for me. Yes, Dr. Lev, you're right. X-ray. X-ray is a special investigation. Radiograph biopsy, Dr. Lakshmi, I love it. Percussion, I don't think it's special because percussion, not special. Even vitality, not special. Sensibility, no. Percussion, no. Vitality, no. Transformation, yes. Biopsy, no. RG, I think that's a weapon. I don't know what is RG. I don't know. RG. Regular what? I'm not sure what is RG. Sorry, guys, I'm very bad in abbreviations, guys. Sorry for this. CBST, yes. Blood work, yes. Biopsy, yes. Good. Periodontal chart, maybe. So, guys, what's the difference? Because this is going to be the scenario about. The scenario may tell you, right? Provide or explain or take special investigations or perform special investigations. Now, if the question about special investigations and then you're going to choose or you're going to talk about vitality test or percussion, I don't think so. RG means radiograph. Okay. Okay. Yeah, thank you very much. You guys say RG is radiograph. RG can be anything in the life, not just radiograph. But let's consider radiograph now. But it cannot be Romeo and Juliet, right? Because Juliet is J, not G. Anyway, so that's what I'm saying right now. Okay. What else about information gathering? So now, information gathering cluster. And the cluster itself, it can give you some signs, some symptoms, and then they may need you to do a special investigation. For example, patient with ulcer, and the ulcer there for more than 2 weeks. What sort of guys of special investigation I'm going to do right now? History, no. I said a special investigation. Ulcer, and the ulcer for there for more than 2 weeks. Biopsy. And then you need to explain in this case, you need to explain biopsy. Good. In OSCE, because guys, again, as I said, part one, part two, they linked right now. In OSCE, the same thing. They provide you a scenario like this. And then they ask you to do something. Now, look at here. Now you will be able to answer this question. Do you think now this scenario is information gathering or is it diagnosis and management? Look at the scenario again. We mentioned that information gathering, they only or mostly provide you sign and symptoms, chief complaint, but they don't provide you with a special investigation. They don't. And they ask you to do or perform special investigation. In this scenario, do you think, did they provide you with a special investigation or not? If the answer is yes, they provided me with a special investigation. So do you still think this is information gathering cluster? Very good, cluster 2. I'm very happy. Diagnose, you see, before most of you answered information gathering. Without I give you now the answer, you now know it by yourself. Yes, this case, it's a diagnosis and management case. Why? How we know it? Because they provide us special investigation. Normally in information gathering cluster, they don't provide us with a special investigation because this is our job. But once they provide us with more details, extra details, which is diagnosis management, sorry, which is special investigation, means now the cluster is diagnosis management. Guys, who guys couldn't clear diagnosis management? Who guys couldn't clear diagnosis management cluster before? Anyone guys had trouble and issues with diagnosis management cluster? It can be, right? Very good. Special investigations provided. So now here, let's look at this right now. Yes, very good, Dr. Nikita. Let me go back here again. Look at this. Explain the diagnosis, or that should be explain the condition, like explain the diagnosis, or explain or diagnose a condition and get a consent for the appropriate management plan. That's very good. Now we understand this. When the scenario provides you with a special investigation, mostly the cluster will be diagnosis and management plan. Take a consent. Is that guys clear so far? Yep, very good. Guys, if it's not clear to anyone, you can ask me and I will repeat again. Yes, Dr. Ashwin, I'm very happy. Dr. Sangeeta, yes, I'm happy. Dr. Shiva, I'm happy it's clear. Dr. Roy, I'm okay. It seems like it's clear to everyone. Happy. Let's now go ahead with this cluster. Could you repeat, Doctor? Okay, Dr. Maria, I will repeat again. So, Dr. Maria, I tell you something, okay? Let me just do this way to understand a bit. We have, let's say, we have three types of clusters. Information gathering, and then diagnosis and management, and then clinical treatments and evaluation. Now, information gathering. What will provide information gather will be provided until here. And then mostly the question or the scenario will ask you to do this part. This is your job. The scenario will ask you, for example, or the question in exam will ask you about the or provide the or explain to the patient the necessary investigation or the special investigation. Means now we're talking about information gathering. But if the scenario provided us special investigations, for example, in here, my special investigation is radiographic examination. We said X-ray is X-ray is special investigation. However, percussion is not. For example, visual is not. So X-ray provided, right? It means as long as I have in special investigation, which is X-ray, in this case means this case right now is diagnosis and management cluster. Why? Because they're gonna ask to diagnose this condition and to get a consent for this patient. Okay, I hope it's clear right now. Here, how to identify each cluster? We mentioned somehow. Now, the question or the scenario will be asking one of these. We'll ask you if information gathering, may ask you about initial diagnosis. The question may say about initial diagnosis for information gathering. And then maybe take an X-ray. 3, information gather. That's all information gathering. A special investigation. Any question or any bold part related to these types of information means your question right now is about information gathering. What about diagnosis and management? What exactly can be there? Diagnosis and management, the question will be asking about could be 1, provide the proper diagnosis. 2, risk factors. 3, pathophysiology of the condition. 4, management plan, either immediate or long term. 5, follow-up visits. If the question or the bold part about any one of these, so now straight away you can tell it is diagnosis and management. Okay. What about for clinical treatments and evaluation? In clinical treatment evaluation, you will find questions normally about this part. Take a consent towards the treatment. Look at this. Do extraction. Do RCT. Explain the complications of the treatment, or what is the complication of the treatment. 4, prescribe medicine. Prescribe medications. 5, refer to specialists. Easy now, guys, how to differentiate now between each cluster? So if you look at the scenario in the first instance, you shouldn't be confused. For part 2, you will find room 1 and room 2 will be information gathering. Room 3 and room 4 is diagnosis and management. Room 5 and room 6 is clinical treatment and evaluation. Let me, guys, check if things clear right now to you. Could you please repeat third cluster, please? Okay, third point, third cluster. Okay, Dr. Bedo, can you please repeat the third cluster? Okay. Please repeat, Dr. Repeat. Okay, I will repeat third cluster. No problem. Okay, let me go third cluster. The third cluster, which is clinical, treatment, and evaluation cluster. What sort of question will be around? It's a treatment. Definitely we need a consent. That's why it's treatment. 2. Apart from consent, what can be? For example, ask for do extraction, do RCT, for example. They ask you to do a specific treatment. 4, it can be discuss complication of the extraction or complication of RCT. So now we're talking about complications. Or what are the complications? Explain the procedure. Explain the procedure. Follow up. Refer to specialist. Guys, am I clear, guys, so far? How to choose the correct option or how to reply with confidence in a role play based on clusters and Australian daily practice experience, an experience. Let's take diagnosis and management cluster as an example. To answer this question, you must understand about this. What does it mean, diagnosis and management? Diagnosis is the art of seeing beyond symptoms, not just symptoms. To diagnose a condition, you shouldn't only look at the symptoms. Like when you look at it right now, not just only the signs and symptoms will be enough to provide diagnosis. You must see beyond this. Why? Because you need to get a blend of signs, which you study in books, skills, which is your brain, how smart you are, and I believe every one of you is smart, and then clinical judgment, mostly coming from experience, and skills as well come from experience. And then you turn the observation into understanding. For example, if you have an X-ray, looking at the X-ray, and something very important, you must interpret whatever clinical examination or clinical test given to you. You actually must interpret it. Because if you don't interpret this examination or diagnostic tools, you will lose the scenario, you will lose the whole question. So you must, and that's why I'm going to do a session soon about X-ray interpretation. Okay, and that's why I'm going to do session shortly, I would say this week or next week, about X-ray interpretation, because it's something very important how to interpret X-ray, either for part 1 or part 2 champions. Okay. So diagnose, what's the definition of diagnosis? You should identify the disease. Can I diagnose a condition if I have a cluster? So let's say if you have this case, and this case is about James Walker, a 55-year-old male, presents to your dental clinic complaining of sensitivity and discomforts in the lower right region. His medical history includes type 2 diabetes, which is weight control and hypertension. On examination, you note a deep occlusal carious lesion on tooth number 46. Tenderness on percussion. Look at this, guys. Deep caries, and then tender on percussion. And the slight gingival inflammation. Radiographic examination shows caries approaching the pulp with no periapical pathology. Can someone of you guys tell me, based on our definition, look at this, of diagnose, we said diagnose is what? Seeing pain symptoms. Not symptoms, not only not enough. I need to interpret the X-ray as well. And then a blend of science, skills, and judgment. Because I see, you know what? I believe we are now crossing 200 plus, right? Maybe 250 on the Facebook, YouTube, and Zoom, or even maybe more. Okay? I believe you're going to give me a different answer right now. What do you think is your diagnosis here? In this condition, what's your diagnosis? Let me check your answer. Deep, okay, signs, symptoms, sensitivity and discomfort. Then deep caries, lesion on tooth number 46. Tender on percussion. Okay, Dr. Simran mentioned a reverse bulbitis. Dr. Sim, and then caries active. Chronic apical periodontitis completely different diagnosis than Dr. Simran. Reverse bulbitis, completely different than the three champions before here. Symptomatic apical periodontitis. Reverse bulbitis per apical periodontitis. You see? Apical periodontitis. That's what I'm telling you. Diagnosis, it's beyond just information. Science is one of it, but you need to have your own critical thinking and judgment on it. Symptomatic apical periodontitis. Okay, it's two things right now. Patient has sensitivity. If patient has sensitivity, do you think the pulp is necrotic or it's pulpitis? Dr. Rana's very, very close. X-ray already given. X-ray already given. The X-ray given here. Look at this. Radiographic examination shows caries approaching the pulp with no periapical pathology. It's pulpitis. I'm very happy. So now your first diagnosis is pulpitis. Now, tooth is tender, but without infection. So what do you think running there in the periapical tissues? Dr. Musa said pulpitis. I agree on this. Symptomatic reversible pulpitis. Okay.
Very good, Dr. Zena. I like this one. Please, guys, everyone like Dr. Zena's comment, please. A reverse pulpitis with periapical or apical periodontitis. Why? Because it's mentioned the tooth is tender, but there is no periapical pathology. When we say there is no periapical pathology, means no, most properly, you don't have infection down there. You just have a little bit of inflammation. Yes, apical periodontitis. Yes, I agree on this. So the X-ray doesn't show radiolucency there. As long as no radiolucency, so it's not an infection. Okay, now, guys? Good. So this is the diagnosis now. What you need to do in this case, you need to explain, right, your diagnosis. So that's exactly what you need to do. What's the benefit out of this? To confirm your final diagnosis, to help select the proper treatment and address the cause, as you see right now. What are the steps for diagnose cluster? The first thing is education. How is this? You explain the process and importance to the patient. It's a part of diagnosis and management cluster. You must explain the diagnosis. Can you pass a case with diagnosis and management without explaining the diagnosis, even short words? No. Without explaining the findings, never. So always pay attention to findings, always pay attention what is a diagnosis, and you should explain a little bit about the diagnosis. Do you think, guys, diagnosis has been given here in this case directly, or you should have done your own calculation, including symptoms, signs, symptoms, your clinical skills and judgment, your interpretation to exam and test, then you end up with diagnose. Risk factors. You cannot pass a case for diagnosis and management unless you know about the risk factors and explain about the risk factors. And there's something here very important. Please, guys, this word, you must keep it in your mind forever. The word which is relevant. Relevant. You must look at the only relevant information in the scenario to talk about it. If you're going to talk about any information which is not relevant, you just waste your time, and believe me, in exam you have no time. So right now, you must address the risk factors. Address the effect. Any damage has happened in the tissues, you need to address it. Pathophysiology. How the condition has happened. You must explain this part, or actually you must know about it, because they may ask you how the condition has happened, or right, this is something you need to explain to the patient to actually understand about this condition to prevent it next time. Am I, guys, clear so far about this? Guys, am I, guys, clear so far? Dr. Taslim, chronic irreversible, Dr. Taslim. Not every irreversible pulpitis is very sore. We have a condition we call chronic irreversible pulpitis. Patients still have a little bit of sensitivity, but no severe pain. You can find this in Dr. Paul Abel book, okay? Yes, you will find it, yes. Okay? That's why I want to give you easy scenario. I should give you a scenario that you think about it. Because exam will be the same. Okay. You know, today, guys, we had champions in the academy, and then they passed part one, and then two of them, and then one passed and one still doing part one, And then they were telling your mock exam is even harder than ADC questions. They've been the exam before, right? I said, really? I don't think so. I don't think my mock harder than ADC exam. Okay. Now, back again. So, guys, these points you must understand about it. All these points you must understand about it in any diagnosis and treatment planning and treatment planning cluster. Management planning. Guys, what do you think, guys, you need to do in management? We done with diagnosis. These other things must be involved in planning. Can you tell me what sort of information? By the way, guys, we go and actually discuss about the difference between management and treatment toward the end, okay? Now, back again. What things involved in the management planning? Let me check your answers. Mock is tricky. I don't think really it's that much tricky. I'm always nice person, give you easy mock. Someone guys can tell what's involved in the management? Payment planning? Maybe. Managing medical condition also is treatment? Maybe. Dr. Sangeeta, I love this one. I love when you said immediate management. What else apart from immediate? Management is follow-up. Yes, it's about a review. Yes. Money, time, condition. Dr. Lev, money, time, condition of patient. I agree. That's true. Long-term plan. Thank you. I love this word. Management, long-term. Yes. Managing the chief complaint without. Refer to special. Yes. Okay, guys, make it easy for you. And that's what we love to hear. Thank you very much, Dr. Amreen. That's when we like it. Doctor, I have yet to pass part one with P helpful too. Will this be helpful too? Definitely, doctor, you will pass. Long term. That's exactly, guys, what we're looking for. We look for short term and long term. Immediate, we call it as immediate management, long term plan, which is long term management, and then present options. Immediate management handle emergencies first. That's called immediate management. Then long-term plan address cause and maintain results. What sort of plan you're going to do must be structured, evidence-based plan, immediate and long-term problems. You must improve the patient awareness, outcomes, and satisfaction. Guys, is it clear now, guys, what should be involved in management planning? Let me check this. Address chief complaint, yes. Agree. And treatment plan, yes. Dr. Mahane mentioned outcomes explaining post-operative immediate and delayed. Very good. Complication replacement or restorative option, if applicable. Dr. Mahane, this is good really, but your comments goes more toward the treatment. Complications more toward the treatment. Replacement option is a treatment. Restorative is treatment, but the top part was actually nicely management. Guys, is that guys clear so far? Okay. Dr. Alifea mentioned something. When do we decide on payment plan in this cluster? Payment plan specifically clinical treatment and evaluation. Guys, what do you think, guys, about treatment plan? Is it management or treatment? Also, is periodontal charting routine or special? Periodontal is okay. This is very nice question, very smart. If you do the basic periodontal examination will be a routine. If you do the full charts, will be special. Guys, you think, guys, money, the treatment plan, I will give you, you know, this is very interesting part now, what I'm going to discuss. Now, do you think treatment plan, is it management part, management cluster, or treatment cluster? Treatment, management, no, treatment, okay. Management, treatment plan is a management, yes, somehow. Management, Dr. Kana, treatment. Dr. Shiva Sharma, okay. It is actually treatment. Dr. Shiva know it very well. She said performing the treatment will be treatment cluster. It's a treatment. On the border. That's really very nice one. Dr. Live like very funny. He mentioned on the border between. This is because confusing for you, right? Thank you, Dr. Kainet. That's true as well. Guys, to know it right now. Now, management means you're going to give different options, and the patient should choose one of these options. That's what's called management. But treatment, once the patient choosing this treatment, like extraction, for example, now it's called treatment. And when you discuss about payment, guys, are you going to discuss about payment for a specific treatment, or when you give the patient the whole plan in the beginning without, and then let the patient to choose one of these, one of them? Management plan, no, the treatment plan, yes. There is a difference between the word management plan and treatment plan. Guys, there is a big difference between management plan and the treatment plan. Guys, do you agree in this? Do you agree that there's difference between management plan and treatment plan? It is involved both because we start discussing variation of treatment cluster 2 and discuss money in cluster 3. Management plan, you give the patient different options and discuss the risk and benefit of every option, and then ask the patient to choose one of these options. For example, if I have a tooth with a reverse pulpitis, but it can be saved, and then I give the patient different options. One, to do RCT, the other one RCT plus crown, the other one is extraction only, the third one is extraction and then implant. Now I give the patient 3 options. Is this called a treatment plan or management plan? And then I discussed the risk of each. I tell them, like, Andrew, you know what? The first option, which is root canal treatment, it's really a good option because in this case, we're going to save the tooth and they will be able to eat nicely. Oh, the second option is extraction. In this case, is you're gonna get peace of mind because you're getting the tooth out, but you're going to lose it. The third one is you're really going to lose it, but we can put an implant for you. It's a management plan. Thank you very much. So what I'm talking about right now, it's called the management plan. Let's say Andrew has chosen RCT. And then I was telling Andrew, I will see you in RCT. I should have seen you. I should see you in 4 times. So do you have enough time to see you in 4 visits? The first visit will be around, let's say, tomorrow. The second visit will be after 3 days. The fourth visit will be about 2 weeks. The last one is about 3 weeks. How we call this one right now? Is it treatment plan or, and then every visit I may need to take an X-ray? Is that now treatment plan or is it management plan? Treatment plan. Why treatment? Because I only choosing one option of the 3 options I give to the patient and start to do treatment. Now, think about it. Do you think the management, mostly, I'm talking, say, mostly, do you think the money, when you speak about the money that they're gonna pay you, will be more toward management plan or treatment plan? Now, are you going to be the time you explain about the different options? Different option of treatments? Or in the treatment when you do RCT, like now, you know what? The RCT will cost you this amount. Are you happy? Ah, doctor, yeah, but it's expensive. What can I do plan? Yeah, okay, you can do payment plan. That's okay. Thank you. Mostly treatment. Thank you very much, Dr. Lev. Thank you, Dr. Ejika. Treatment. Thank you, Dr. Sarah. Thank you, Dr. Karishma. Is that Karishma or charisma? Like charismatic, right? Yes. So, guys, it's treatment plan. Now, let's summarize this. What's the difference between treatment and management? Guys, there's a difference between treatment and management. Scope for management, holistic, short and long term. Treatment is specific problems only, like extraction, restoration, RCT. Focus, prevention, education, follow up. You keep talking to the patient about things. We may need to do this options, we may need to do this, you need to do this at your home, you do this, whatever. But treatment, it's clinical intervention. I always say physical treatment, extraction, RCT, denture, something physical. You start to do something by your hand as a dentist. Rule, patients involved, mostly the patient. And that's why you explain the treatment to the patient, so he need to choose which one. You give them good holistic approach and preventive approach at home. He the one should apply this, like brushing, mouth rinse, all this stuff. But treatment clinical lead, who going to start the treatment? Is it you or the patient? Who's going to hold the handpiece? Who's going to hold the forceps? Who's going to hold the endophile? Definitely the dentist, clinician lead. That's the guy's difference between management and treatment. Guys, is that clear, guys, so far? No, consent. Even if you do investigation into consent, information gathering, you need a consent, diagnosis and management, you need a consent, clinical treatment and evaluation needs consent. Guys, how does it sound to you right now? Yes? Okay, good then. Okay, guys. I hope, guys, this session was clear enough to differentiate between the clusters and each others, okay? Okay, guys, sorry, guys, I was in the academy the whole day, and then I just arrived before I start the session. So, guys, I believe we done very good for tonight's session for clusters. And then if you want me, go ahead more cluster-wise. So, guys, I can do it next session. Thank you very much, you guys. Have a great night, every one of you. Tomorrow is our private session. Need to apply them in our mocks. Yes, please. No problem, Dr. Ashwini. And the payment is under treatment. Yes, payment, doctor, is under treatment. Thank you very much, Dr. Taslim. Thank you very much, Dr. Natali. Thank you very much, Dr. Barla. Thank you very much. Thank you, Dr. Gagandip, Dr. Chloe, Dr. Kainet, Dr. Fatima Braven, every one of you guys. Thank you very much. Have a great night, Dr. Simran, Dr. Rahlama. Thank you very much, Dr. Nikita. Thank you, Dr. Mahin. Thank you, Dr. Lev, very much. Same to you, Dr. Lev. Thanks very much. Thank you, Dr. Asanka. I like your name, Dr. Asanka. It's a nice name. Thank you, Dr. Lakshmi, Dr. Alifia, Dr. Umalia, and everyone, Dr. Adila, and every one of you guys. Dr. Fatima. Sorry, guys, if I miss any of your names, guys. A few names. Thank you very much, you guys. Have a great night. Dr. Amreen, Dr. Srisha, Dr. Saral, thank you very much. Dr. Charisma, thank you. Dr. Bala. No problem, Dr. Bala. Bala. Thank you, Dr. Adila. Thank you very much, Dr. Alifia, Dr. Adila, and every one of you guys. Thank you very much, Dr. Haisha, Dr. Saral. And Dr. Amreen. Thank you, guys. Have a great night, every one of you guys. Thank you very much. Bye-bye. Bye. See you tomorrow then. No problem. See you tomorrow then in the private session. Thank you, guys. And I believe Friday as well. We may have a session Friday too. Thank you. Thank you very much, Dr. Sarah. Thank you, Dr. Tasneem as well.